Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Good morning and welcome to a Cardinal Minute. I'm Dr. Kim Allen Williams, Chair of Medicine at University of Louisville, and I'm joined this morning by Dr. Tao Lee, who is our allergy and immunologist specialist, and he has hosted our grand round speaker, Dr. David Peden, who is the Andrews Distinguished Professor of Pediatrics at University of North Carolina, who gave a marvelous presentation on air pollution effects on respiratory and general health. Dr. Peden, can you give a 1-minute summary of your talk?
Sure. Number one, people across the United States are exposed to increased levels of air pollution, some very consistently, some just episodically. The air pollutants that are the worst are particulate matter and ozone. The diseases that are most commonly affected are asthma, but there's also very significant effects on cardiovascular disease. There's very significant effects interfacing with infections like COVID. But most importantly, there are things we can do about it. We can offer personal advice to individuals, which is to reduce exercise and reduce outdoor exposure to ozone. For some people, it might make sense for them to use an indoor HEPA filter and to be able to do some air filtration devices inside their homes. It would make sense to use masking when there's bad air outside, especially PM, although we need more studies for that. Really good idea to keep, if you've got a chronic disease, to keep that in as good control as possible, because that's going to decrease the amount of the likelihood that you're going to have a worsening with air pollution. And lastly, advocate for clean air. It's very, there are governmental changes that can happen if communities decide they want cleaner air. They, collectively, community can have that by increased pollution controls, different patterns of use of automobiles, et cetera. So it is a difficult problem, but it is not a hopeless one.
Well, we really appreciate your insights this morning, particularly those revolving around health equity or health inequity produced by differential levels of air pollution. And so thank you very much. And this has been a Cardinal Minute.